My name is Emily English, and today I'll be speaking to you about cognitive behavioral therapy. CBT, aka cognitive behavioral therapy, was not such a popular idea in the psychological world. Back in the 1960s, CBT was first developed in hopes of treating depression. But as time continued to pass, more ideas were added onto the therapy, making it more suitable to treat other mental health conditions like anxiety, marital problems, eating disorders, and substance abuse disorders. In the 1960s, a psychologist by the name of Alan T. Beck first discovered the idea of CBT while communicating to his patients. He saw there some internal dialogues going on inside their heads, almost like they were talking to themselves. This helped Beck to understand how instead of him exclusively helping his patients could also help themselves. This gave the patients a way to suitably make goals for themselves so they could more effectively treat themselves outside of therapy and quicken the healing process. CBT's inclusion of technology is through the use of VR machines, chatbots, text-assisted CBT, automated text messages, and CCBT, computerized CBT. The positive aspects of delivering this therapy online is with VR creating a more literal experience rather than imaginary. Online chatbots being used whilst in the COVID-19 crisis, where travel was difficult. Text-assisted CBT helped towards a more easy-to-understand the CBT model. And unemployed women who receive 4 automated messages a day had depression symptoms significantly go down. As well as with CCBT, it was found that it has a very high user acceptance rate and overall positive impact on mitigating user depression symptoms. But there are also negative aspects to the online world of CBT, including lack of personalization to the patient, may feel like a group identity, no appropriate sensitivity afforded to the patient, the concept of CBT not being completely understood or used correctly, reading and writing skills being a barrier to participate in the therapy, the therapy being commercialized instead of personal, and the lack of ethics instilled in AI chatbots, being a lack of non-maleficence, beneficence, autonomy, justice, and explicability. The main test of CBT as spelled out in its goal-setting acronym SMART: specific, measurable, achievable, realistic, and time-limited. Strengths of this method or tenet is the ability to plan out what you want, understand yourself better, and change yourself easier. The limitation of the method is the time limit instilled, which puts pressure on some highly anxious patients. As we know, CBT's main targeted illness will be depression, as it started out with that and is still widely used to treat it. CBT has been shown to be effective at treating depression in many studies, including but not limited to the efficacy in CBT being very strong for disorders like depression, schizophrenia, insomnia, and a wide range of other mental health illnesses. As well as the treatment with anxiety disorders, 3.9 years after taking CBT, completely lose their anxiety diagnoses, showing a perfect improvement. And there are many more studies proving the efficacy and effectiveness of CBT, with also one study recording CBT as 50 to 75% effective for overcoming depression/anxiety, up to 5 to 15 modules of it. So CBT is definitely the right way to go if you or anyone else needs therapy. But the negatives to CBT include you have to put in the effort of therapy, it's not suitable for most complex mental conditions, it'll get worse before it gets better, and it causes much discomfort and anxiety. It doesn't address underlying reasons behind your emotions, like past childhood. It doesn't address external problems like family, school, and work, all of which the patient can't control. Here is a case example clip of CBT. The tenet shown in this clip is how avoiding problems only makes them worse. Issues involved in this clip includes depression, long-term sadness, parents' marital problems, doing badly on an exam, dislike of failure, feeling worse than others, and bad sleep. And the goals achieved in this session were uncovering their emotions, opening up to someone, and finding out a voice that helped keep the cycle going. In conclusion, CBT is a cognitive behavioral therapy as implied by its name. This therapy is main focus on how thoughts create feelings and how feelings impact behaviors, and how to use this knowledge to solve the problems more effectively. CBT is a question-oriented therapy with the patient's psychologist simply guiding them to their own answers and solutions to the questions asked. Cognitive behavioral therapy is effective for many disorders, but not exactly all yet. As shown with CBT's past history, it's likely as time keeps progressing, CBT will keep progressing and help more disorders over time. Thank you for listening to my speech. Some sources used in the speech were acquired from Wikipedia, an often under scrutiny source. But since they are also backed up by other sources and contain no suspicious information, they can be seen as credible. The other sources I have acquired were from a network, organization, government, and YouTube sites. These sources can be seen as credible due to the links to other sources included and the psychological professionals behind them.